Hey guys, and welcome back to The Upper Hand. We are continuing our series on modalities, and today we are talking about fluidotherapy. After this video, you will know what it is, what all it is used for, if there are any contraindications, and when to use it. So let's jump right in. So fluidotherapy is a dry heating agent that transfers heat by convection, and it consists of a cabinet that contains finely ground cellulose particles made from corn cob. I usually just tell my patients that it is ground up corn husk. So it uses heated air that circulates through the particles and basically suspends and moves them so it acts sort of like a liquid, and it's essentially a dry whirlpool. So we typically will place either the left or the right hand into the machine, whichever one is injured, or sometimes even both if your machine allows for that when you have a bilateral injury. We usually set the timer for anywhere from 10 to 15 minutes, and we allow the patient to just relax in the heat as well as move while they are in there so that they can loosen up the tissue and the joints that may be tight or stiff. The heat is typically set around anywhere from 100 to 118 degrees Fahrenheit. So most of the time we have the patient warm up in the machine at the beginning of the treatment session just to kind of warm up the tissue and prepare for better and easier movement. But I have put someone in the machine after the therapy session almost as like a cool down to help them feel better before they leave. And again, it is obviously good for loosening up joints and helping increase range of motion, but it's also good for pain reduction and can also be used as a form of desensitization as well. So if someone has a sensitive scar and can't really tolerate the medium hitting them in the affected body part or on that scar, there's a setting on your machine that will allow you to decrease the airspeed so that it will be less abrasive to the patient. So let's talk about contraindications. Obviously, you can't put someone with a wound into the machine. And I've never really had someone come out of the machine more swollen than when they went into the machine, but it is a form of heat, and that is certainly a possibility. And typically when patients are moving, they're kind of pumping that fluid out of the hand or the wrist or whatever the injured body part is. So if you have someone with an extremely swollen hand, it may not be the best modality choice starting out, but typically we don't have any issues with increased swelling. So who do we use it for? To be honest, almost everyone. If they don't have one of the contraindications listed above or have some type of tendon injury and their protocol doesn't allow active range of motion yet, then they are most likely starting in the machine when they come in our clinic. Again, there are patients that don't like the feel of the medium, but most of our patients like it, so typically that's where they're starting out when they come in. One other way it can be used that I've never personally done is most units have holes kind of in the top of the machine, and it's there so that therapists can put their hands in as well and perform maybe a passive range of motion while the patient is being heated up. Usually I would just stick the other person's hand in at the same time so that they would be able to perform the passive range of motion on themselves. So there you go. That was a very simple breakdown of fluidotherapy and how it is beneficial to our patients. I really can't imagine not having one in our clinics. As always, we love learning more. If you feel like we missed something big, please let us know in the comments. We'll see you guys next time.